You come and find that we have managed to get very many children to come on board and come to school and they're attending classes.
That's true.
But how many children are being taught by how many teachers? What are we spending the funds on? I have been to schools up country where the government is struggling very much. We have like the CDA fund.
Yes.
They're giving the schools money to buy computers and all, but they don't have classrooms. They are struggling to give them CDA funds to put electricity.
Yes.
I'm asking, are they going to fix the sockets for the electricity on the trees? There are no classrooms. A classroom takes about 70 children. Why don't we use the funds? I think we're setting our priorities wrong. They've been set very wrong.
How should we do it? Because yes, there is a need to have classrooms.
Yes.
Many people are calling, mushrooming of schools as a political tool.
For education, I would say priorities should be set right. For poverty eradication, I would want to talk about policy like the one for vijana.
Yes.
Kazi kwa vijana, which we say kazi kwa vijana, pesa kwa wazee. That has been a very unfortunate thing, because what has happened is that the policy was, it had the good intentions to help the vijana come out of this poverty.
True.
But who are the people who came up with the policy? Did any of us youth, were we called to come and sit on the table and discuss the policies? Never. It seems like nobody counts any sense in us. Yet we've gone to school, we're educated. You understand? So they came up with the policy. They only bring us on the implementation stage. And guess what? To do the kazi ya mkono work, to carry the stones and to do all that. And that is very unfortunate, because we also have papers. Go to the road and see the guys who are slashing the roads. They have papers.
They do, yes.
They can go to school. And what does the government do instead? They increase the retirement age from 55 to 60. So when are we supposed to go to work? When are we supposed to start working ourselves? At 38. And the guys who are working at 60, social injustice come in, that the ones who are working, they'll bring in their children to take up their jobs. That's when they're leaving. What about us children who our parents probably never got any jobs anywhere? Where do we go with our papers? That is social injustice.
I see what you mean. Here's to the both of you. So you've spoken about the difference in terms of red tape. You've spoken about priorities in terms of allocation. If you are to choose between allocating budgetary resources to, let's say, primary health care against treatment and care.
So,
and both are important.
Yes,
I would
right.
imagine. But which one would you prioritize first?
You're talking about primary health care?
Yes.
And then?
And then treatment and care.
Treatment and care.
Exactly.
Exactly. So, according to me, we need to look at where does Kenya come from.
Okay.
Kenya comes from a country of, like someone explained, we have 10 million poor men and 10 millionaires. 10 millionaires.
Yes.
So you realize that then it becomes very important that primary health care is critical. I'm looking at that mama in the village who really has no way of getting medication. She has no ability at all.
Right.
But we need to bring some basic minimum. Yeah?
Right.
Some basic minimum of providing some basic health care to everybody.
That's true.
And that's why I was agreeing with Anyang' Nyong'o. It's only that the way he went about it was wrong.
Right.
Yeah.
But really, if we create that base, that basic foundation, then from there, we can start building on now that the other aspects of medication, of medical care.
Right.
I think that would be the best approach, according to me.
I see what you mean. New Nyanza General Hospital has the Obama Children's Ward, where the operational resources are subsidized by USAID. Can this be replicated in this country using public resources? How would you use that in terms of create implementation, so to speak?
Let me tell you, Jimmy, this government has so many ways of raising funds for such schemes.
Yes.
And it has had such like programs.
Yeah.
So many public hospitals get a lot of medicine.
Yes.
But what happens is corruption. Let me tell you this. I go to hospital. It's a public hospital. Medication is free or is subsidized and that kind of thing. I go there. I get diagnosed.
Yes.
They say you have this problem or this problem. Then the doctor specifically tells me that go to this particular chemist in town and buy medicine.
Yes.
What does that mean? Medicine has been siphoned, meant for me in the hospital to that particular chemist. That's what's happening in this country. Actually, the USAID program is just because our corrupt officials have not gotten a hand to those medicines.
I see.
Yeah, that's what's happening. This government has allocated enough resources to medication. The problem that we're having is how the same is being implemented.
I see what you mean.
That's
So let's move away from healthcare. You're more in terms of social justice.
Yes.
I would imagine because you're passionate about education. So let's talk about illiteracy rates.
Yes.
And let's say more specifically in Western Kenya, which is a concern. Are there any proactive measures you have in mind in terms of alleviating the issues pertaining to illiteracy?
Illiteracy.